If you ever had a knee replacement, hip replacement, or ankle surgery, you may be wondering, can I ever run again? And some people say never run again, while others are running, marathons right after surgery. The truth is more nuanced than that. The better question is not just can you run? It's has your body earned the right to tolerate running again? I'm Dr. Ray Peralta, physical therapist and run coach, and over the past 10 years, I've helped hundreds of runners get back to running, hitting PRs, marathons, and even help runners actually get back to running after major surgeries, including joint replacement surgery as well. So, the problem many runners over 40 are told their running days are over after joint replacement. And running creates more impact than walking. If you're not aware, that running can actually be every time your foot hits the ground, it's about 2 to 3 times body weight. I'm just going to show you the quick image here. So yes, every time your foot hits the ground, we're looking at 2 to 3 times body weight. So if you're a 150-pound runner, right, that's 300 to 450 pounds of force, right? And obviously, the more you weigh, so if you're a 200-pound runner, then it would be 400 to 600 pounds of force, right? So it's essentially it's a high impact sport. People don't think about it that way because they think of sports like football where it's a contact sport. No one's tackling you when you're running, right? When traditional running, that is. But it is so they're like, oh, how's running a impact sport? But it is. Running is a high impact sport. Every time your foot hits the ground, there's some joint reaction forces going through your leg, and it's going to create more impact than walking, cycling, swimming, or rowing. And the concern is not just one short jog; it's repeated impact. Especially think about doing a long run. How taxing that could be on your body. Going out for like a 6 mile long run, or 12 mile long run, or even going for a full on marathon. And then trying to also sustain that running, not over just a one time thing, but doing it month after month for years. Surgery may replace the joint surface, but does not automatically restore strength, balance, mobility, or impact tolerance. That's why rushing back to running can lead to pain, swelling, or limping, or setbacks. And then, many running injuries, same mechanism for flare ups after joint surgery, right? Running can add more load on the body, whether it's in terms of the speed, mileage, the distance, right? The terrain, going from like a treadmill to outdoor, doing an incline or uphill or doing downhill running, change the footwear, all these things can impact the load. And so we need to bring up the body's load tolerance or the body's capacity. But if you don't have the tolerance or the capacity, the body breaks down, right? It gets inflamed, there's more pain, right? If your tissues are not strong enough, if you're not getting enough sleep, or you're sleep deprived, your body tends to break down a lot easier. If you want to copy this Google Doc and want to learn more about running pain-free after 40, I'm sharing resources like this inside my free school community for runners. Click the link in the description to join. So the steps, one, make sure if you just had a major surgery like this, like a knee replacement or hip replacement surgery, get surgery clearance from your surgeon. Make sure that your orthopedic surgeon has cleared you to get back to full weight bearing. Now, they may warn you against it because, it may wear out the joint sooner. So let's say your joint may have lasted, 10 years or 15 years. Now, it may only last 8 years. But this is in theory, right? There's no hard evidence to show that running will necessarily like really speed it up. But in theory, yes, in theory, that running can wear out the joint faster than if you just stuck to walking after like a major surgery. That's why there's always risk involved with taking up any sport, but running's also not just like any sport. There's always a risk. But that being said, if you really want to run, and if your surgeon gives you the green light, saying gives you the warning that it may wear out the joint, but otherwise you're cleared to do it, just make sure you get the surgery, the clearance, just so you understand, and especially with the hip. Sometimes there are hip precautions that may vary based on your surgical, whether they went an anterior approach, a posterior approach, right? Whatever the approach was, the surgeon may warn you against running because they may put more stress on that, may cause like your risk of dislocation potentially. So obviously talk to your surgeon. And then also ankles replacement surgeries also may require more caution. Surgeon may make you wait a whole year before you start resuming. So don't copy someone else's comeback story online. Like someone say, "Oh, I went back to running 4 months after my knee replacement surgery," but it may take you a year, right? People's timelines may vary. That's what I'm trying to get at. But you also if you don't know what you're doing, obviously talk to your surgeon to get more guidance as well. And then two, understand that running is a load. Right? Running is not automatically good or bad. It's just a load that you place on the body. Again, your body has enough load tolerance, right, to tolerate, right, enough capacity. If a load exceeds the capacity, symptoms show up. And again, these signs could be pain, swelling, stiffness, limping the next day, flare ups. If every run creates a setback, you're not training, you're irritating the joint or the tissues around the joints. So build the foundation first. Before running, ask, can you walk briskly for like 30 minutes without pain or swelling? Can you go up down the stairs with, good form, good control? Can you squat? Can you step down? Can you balance on one leg? Can you do a single leg sit to stand? And that's where you get up out of the chair on one leg. Can you perform calf raises, single leg calf raises, single leg bridges, right? Basic strength work. Can you pass hop testing? When we talk about hop test, single leg, right? There's single leg hop for distance, single leg 6 meter timed hop, compare left and right side for symmetry, right? So let's say your right side had surgery. You want to see if your right side can keep up with the left side in terms of the distance, the time, etc. Here's a triple hop for distance, again on a single leg, how much distance you cover on the one leg, and then a crossover hop, and also you measure the total distance. So if you do these different hop tests and there's symmetry, at least like 80% or more, or even 90% or more, even better, the more symmetry, the better. That means the stronger, have enough power. It can give you more confidence that your leg is ready to return to running. And then, can you tolerate low impact cardio without that? Can you tolerate biking? Can you tolerate incline walking? Right? Can you do that for like 30 minutes? Right? With a little bit of increased intensity. And then once you know that you're more feeling confident, you can start with some walk run intervals, right? Don't start with straight ahead running, right? Don't go run for an hour or even 30 minutes. Start with like a 5 minute warm up with walking, and then just jog for 30 seconds, then walk for 60 seconds. But if that's too much, heck, you may even just jog for 10 seconds, walk for 50 seconds, and then repeat it for 10 minutes or 20 minutes and do it 2 times a week or even 3 times a week, depending on how your body tolerates. I say start with 2 times a week. If that's fine, then the next week you could go to 3 times a week, but make sure you have a recovery date in between run walk workouts, and progress only if there's no pain. In terms of progression, you can make it longer, obviously going from 10 minutes to 20 minutes or from 20 minutes to 25 or 30 minutes and so forth. And then eventually you make the run interval shorter, or run interval longer, excuse me. So from, let's say, a 10-second run interval, maybe you start progressing to 30 seconds, then a minute, and 5-minute run interval, and then just a shorter walk period. But you also want to monitor, make sure there's no swelling or limping or pain the next day. So make sure when ready to progress or not. And then use strength training and cross training. Do not rely on running alone to build fitness, because running is one-dimensional. Use strength training 2 or 3 times per week. Low impact cardio 2 days per week, cycling, rowing, swimming. To go the cardio, for example, the cross training, the bike, and the strength training could be combined on the same day. So you may do like a strength training session for like 20 or 30 minutes, and then do like a 20 or 30 minute bike ride for like an hour workout twice a week. And if you're really pressed for time, you can even make it 30 minutes, right? You could do 15 minutes on the bike, 15-minute strength training session. And then add daily mobility, at least 10 minutes a day, to mobilize your tight or stiff areas to maintain joint motion and reduce stiffness. The goal is to build enough capacity so running does not break you down again. The results, many of the runners I've worked with are able to return to jogging. Some runners, use run walk intervals long term, right? The run walk method. Even use it for races, 10K, half marathon, full marathon. And some may only run 1 or 2 days per week and then cross train the rest of the week. It's fine, right? And some runners are able to do 3 times a week. I'm a big fan of 3 runs per week framework, right? But again, some people may not be able to tolerate 3 runs and may only have to do 2 runs, right? Whatever works their schedule and their body's recovery ability. And some may be better served by just, switching to cycling because they can't tolerate running at all. Unfortunately, that does happen. Sometimes there are people who, after joint replacement surgery, the pain, it flares up too easily with running, and they could only really rely on walking and biking. And that does happen, or swimming. But the real win is just to stay active, strong, and pain-free, and not force running at all costs if your body, really can't tolerate the demands of running. But if you build up your body safely, I do find that many people can build back up to running, the run walk method, at least when they stay consistent. Consistency is a key thing with strength and their mobility training. So I currently have a few spots open to work with me privately for one-to-one coaching. I help runners over 40 get back to running pain-free with a smarter plan. We focus on running, strength training, mobility, and recovery. If you're curious, there's a link to apply in the description. First come, first serve. So in conclusion, running after joint replacement may be possible, but it's not a guaranteed thing. You need surgical clearance, right? Make sure you have adequate strength, mobility. Make sure the pain is under control, right? There's no other signs like no swelling or limping. And build the foundation before you chase mileage. You're not trying to prove your new joint is invincible. You're trying to run, recover, and stay pain-free for the long haul. If you found this useful, hit the like, comment, and subscribe, and I'll see you on the next one.